Good morning, everyone. We're going to go ahead and get started now. So I just want to welcome everyone and thank you for attending this event today. As you may know, I'm Juliet Odogu and I'm Deputy Director of Programs and Impact at eHealth Africa. And on behalf of everyone at eHealth Africa, I want to welcome everyone and thank you for attending our event today. This for us is a double celebration. Not only because we're celebrating our 10-year anniversary and we're 10 years old and really proud of that, but we're also celebrating because Africa has been certified wild poliovirus free. And so for us, that's a double milestone that has been achieved this year. And we want to use this event to celebrate our successes, not just as eHealth Africa, but also as contributors to this milestone within the space that we worked in. And so we're very pleased to have everyone, both from internally within eHA and any partners that are joining us today. We thank you for joining us to celebrate this event, and we hope to interact with you throughout the course of this event. So we'll kick off with opening remarks and a welcome video, and we'll take the agenda from there. Over to our help desk team.
Hi, everyone. 2020 marks eHealth Africa's 10th anniversary, and we could not be more proud of the work eHA has accomplished in such a short period.
eHealth Africa is the pioneer organization that brought technology and data systems to public health in West Africa. We set up our first ever medical record system in Nigeria in 2010. We were one of the first groups to do electronic data collection for public health surveys. We created the most extensive GIS-based maps of Nigeria, and we managed a great deal of the data systems during the Ebola outbreak, setting up data-driven EOCs, emergency call centers, and contact tracing systems across 4 countries.
In addition to that, we have had a huge impact on public health. We have delivered over 40 million doses of life-saving vaccines across Nigeria. We stopped a devastating Ebola outbreak from spreading further into Nigeria. We helped eliminate Ebola from Sierra Leone, Liberia, and Guinea. We implemented the Ebola vaccine trial in Sierra Leone, ensuring an outbreak like the one we saw in 2014 and 2015 will never happen again. And one of our most proud accomplishments, we helped eradicate wild polio from Nigeria.
When Evelyn and I founded eHealth Africa in 2010, we had no idea that it would grow into what we are today. Of course, we are proud of the work that eHA has accomplished, but we're also proud of the organization that eHA has become and how the values and morals we built the organization on have stayed with us as we've grown. At eHA, we have employed over 3,500 people across the countries we work in, 4 countries in West Africa, Germany, and the United States. We've trained over 150 interns. Over 90% of our employees have had career progressions, including salary increases and promotions. And we've spent over $2 million in trainings and staff development. In addition, over 35% of our employees are women, and about 50% of our leadership team are women. Over 95% of our employees are local to the countries that we've worked in.
To say that eHealth Africa has been a big part of our lives over the last 10 years is an understatement. We have learned so much, built a great team of people, and feel that eHealth Africa is ready for our next phase as an organization. We know what it takes to make a project successful and impactful. And we know that making a sustainable impact needs a business model behind it.
As the eHA moves into the next 10 years, we will be taking the lead in developing our ideas that we believe in, ensuring they are successful. eHealth Africa has had an incredibly impactful first 10 years, and we're excited to see how eHA evolves over the next 10.
Thank you to all our staff, both current and former, and to our partners who have made our work possible. Congratulations, eHealth Africa.
Congratulations, eHealth Africa.
Great. Thanks for those opening remarks from our executive directors, Evelyn Castle and Adam Thompson. Next, we'll just take some messages and goodwill remarks from some of our partners, members of our boards, and some of the stakeholders that we work with.
Greetings and salutations to everyone at eHealth Africa. My name is Andrew Carlin, and I'm a proud board member of eHealth Africa since 2017. I would like to extend to you and the entire eHealth team a heartfelt congratulations on your 10-year anniversary. Well done. It's been quite a journey. Firstly, I would like to appreciate the dedication to excellence and commitment that you have demonstrated over this period, leading to the most marvelous of achievements, the eradication of polio in Nigeria. This is truly a tremendous accomplishment. 10 years is a good amount of time to reflect on one's accomplishments. Over the years, I've watched eHealth grow and evolve as an organization. From the early days of training open MRS to students at the Sheikh Regis College of Health Science and Technology, to the Ebola response in West Africa, to polio eradication today. eHA has embodied the spirit of cooperation, collaboration, and self-reliance that makes it an exemplary organization. When I first came across eHA in 2010, I was amazed at how this small, intrepid little group could do so much with so little and do it so well. Today, I see the same spirit, just in a larger, more impactful footprint. From world-class clinics and laboratory facilities in Kano and Abuja to EOCs across the country and region, eHA has responded to the many challenges of delivering essential health services across the region. Going forward, despite the challenges of coronavirus and other unknowns that the future might hold, I'm confident in the knowledge that eHA will always rise to the occasion and continue to deliver important health and social services to the communities of Kano and northern Nigeria and the region as a whole. I congratulate you once again on your achievements, your commitment to excellence, and future contributions. I'm proud to be associated with eHealth Africa, and I lend my full support and encouragement for your work. Hear, hear to eHA. May you enjoy another 10 years of success and happiness. Well done all. Thank you.
Hello everyone. My name is Micheline Ntiru, and I'm absolutely delighted to serve as a member of the board of eHealth Africa. Congratulations on this 10-year terrific journey. I find the eHealth Africa teams that I have met to be incredibly tenacious, focused, dedicated, possess this drive, and collectively you've been able to come so far in the region. Of specific mention and super impressive is the work that eHealth Africa has led in terms of polio eradication. So once again, kudos, brava, thank you all so much for your superb work. And here's to decades and decades and decades more of impact. Bye-bye.
And now we'll take some additional messages from our partners as well.
I'm Deputy Director of the Polio Program at the Bill and Melinda Gates Foundation and a friend to eHealth Africa. First of all, I want to congratulate you on your 10th anniversary. Wow, big accomplishment for you as a group and all of the fantastic work you're doing in Africa. And also, I want to take a minute to thank you for the work that eHealth has done to help make Africa free of wild polio virus. It's been a long journey, a tremendous amount of work, and eHealth Africa has been a vital part of that success. I've been working with eHealth really since the beginning. Adam and Evelyn will recall, the early days of trying to figure out how were we going to do GIS maps and how were we going to do that data collection. And then it got really funny. We started distributing sugar, Borno, all of the very complex pieces of work that actually go into making a successful program. And I guess the hallmark of the polio program in Africa and in Nigeria in particular was innovation. And if you're going to go to anybody to try to innovate, you go to eHealth Africa. And you guys have been such a big part of what we did different to get to the finish line, especially around the GIS maps. So I just want to take this moment to thank you, congratulate you, and wish you all the best as you continue to make such a big impact in the lives of the people in Africa. So thanks, eHealth Africa. Congratulations and best wishes for the future and the next 10 years.
I wish to congratulate eHealth Africa for this 10th year anniversary. And for the Kano, what this means is 10 years of innovation, 10 years of partnership, 10 years of working together. I recall when the eHealth Africa was trying to sign an MOU with Kano State Government, Bill and Melinda Gates Foundation on certain of the EOC and also some of the polio support. Then I accompanied the then Director of Public Health, Dr. Mohamed Nasir Mahmoud, to the eHealth office. That was when the idea of eHealth was conceived to support Kano. And that has been an awesome journey for these 10 years. We witnessed rapid advances and introduction of technology, of GIS mapping, of so many technological innovation in the health space of Kano, which were not earlier available. And for this period of time, there has been a lot of progress made possible by eHealth being in Kano.
I would say a big congratulations to eHealth Africa. eHealth Africa is a household name in Kano. I'm congratulating eHealth for so many things. Number one, for their ability and capacity to uphold the support and running of the EOCs, particularly and especially that of Kano State. This is a very kudos to them, and then to the government of Kano State and collaboration. Also, if you look at the issue of sample collection site, eHealth Africa has provided one of the sample collection sites for COVID-19 sample collection and testing in Kano State, and that one is also something to speak. I would say that I am personally giving eHealth a big thank you, and then on behalf of the Kano State Ministry of Health as well as Kano State government, we want to assure you that the state government is ever ready to collaborate with eHealth and then to work together with eHealth for more prosperity, more achievements, and then record of successes that will showcase their ability and capacity to do very well in terms of seeing that healthcare service delivery is talk of the day the world over.
Okay. Good morning. I am Dr. Ali Shetima, the former incident manager, Polio EOC. I work with eHealth at least for 5 years now. So, and we find them useful, and also they support the state in many ways. They are able to provide what we need in the EOC, and also the technical team were able to support our data and also tracking of workers, so that is the frontline workers doing vaccination. And also, they also introduce a lot of new technologies. We have this BTS, and also we have the mapping of areas, and also they produce most of our maps, or all of the maps. Okay, and also in collaboration with other partners, they are also able to support the state in vaccine management and transportation. So by using the EDGO for RI and also for RIC. So far we are able to achieve the important milestone. So we wish eHealth a 10-year anniversary. Thank you.
This is Dr. Melton Musa. I work for CDC Afinet in Borno as a senior field coordinator and the team lead for Borno State. We've worked with eHealth Africa on the polio eradication initiative in Borno, and the digital support that eHealth has brought to the polio eradication has brought new changes in terms of finding out exactly where services are provided, mapping them out, and ensuring that those places that have not been visited are identified and they are also visited. This has impacted seriously on the work we have been doing and has made us to be able to reach the point where we'll be able to say clearly where we have not been able to visit, where we need to visit, and where we need to use military support and all those things that we need to do. I want to, at this point, wish eHealth Africa happy 10-year anniversary. Thank you very much.
I am Karina Praki, Program Manager for Polio and Communications for Development for UNICEF in Borno. Together with eHealth Africa, we are among the partners supporting the Borno Polio EOC, the Emergency Operations Center. eHealth Africa provide us with detailed information so that we can see clearly what we've achieved and where we have work yet to do. This is particularly important in Borno, where we have reached and unreached settlements, and therefore we have reached and unreached children. I want to congratulate eHealth Africa on reaching 10 years of successful evidence sharing that has guided our work and supported our efforts in reaching polio-free status for Nigeria this year, as well as now polio-free Africa. The professionalism, the drive for quality, and the exemplary teamwork, these are what really stand out for me when I think about the eHealth Africa team here in Borno. 10 years. I can only hope for many more decades of successful collaboration with you all, wherever our paths may cross. Happy birthday!
Hello everyone, I am Keba Toure. I work for the Polio Eradication Program at the WHO Regional Office as Technical Manager for the Afro-GIS Center. It is a great honor and privilege for me to join all of you today at this special event to also celebrate with eHealth and the entire staff the wild polio virus certification for the WHO Afro region, as well as your 10-year anniversary. My connection with eHealth started in 2013 when I was technical officer for WHO country office in Nigeria and also GIS focal point for the Polio Emergency Operations Center. eHealth at the time was already involved in supporting different mobile health solutions, but started extensive GIS operations to support polio vaccination activities, especially in northern Nigeria around the same period. They were therefore one of the key technical partners, among others, to support WHO, government and partners' efforts in ensuring every child is reached with polio vaccine. The impact eHealth has had in polio and other health programs goes beyond Nigeria to other countries in the region. For example, they have played a pivotal role in the technical implementation of the autovisual AFP detection and reporting AVADA in 10 countries in the region to strengthen AFP surveillance at the community level. Therefore, your organization's efforts in providing technical solutions to data collection and analytical processes has no doubt contributed to the successes recorded in the eradication of wild polio virus from the region. It is therefore not surprising to hold this special event alongside the 10-year anniversary, as your work over the last 10 years has put an indelible mark in the healthcare sector in the region, especially in the area of improving the quality and availability of healthcare for underserved populations by providing data management and logistics support for enhanced decision-making. I would therefore like to join others to congratulate eHealth and their entire staff for their contributions to this historical achievement. I encourage you not to relent in your efforts in venturing into new areas of innovations and also broaden your operations to support more countries in addressing some of the challenges faced by our health sectors. You'll all agree with me that the use of technology is key to ensuring the effective use of data for action. This was extensively demonstrated by the polio program across the region with the introduction of different innovative solutions to ensure improved vaccination coverage. I would also like to call on the e-health management to continue investing in capacity building programs, and this will provide more sustainable approaches to improving the health of our populations. I would like to thank you for inviting me to this event and congratulate you once again on your 10-year anniversary, as well as your contributions towards the attainment of a wild polio virus-free status for the WHO Africa region. Thank you very much for your attention.
Hi, my name is EA, and it's a pleasure to have the opportunity today to thank you for all the work that y'all have done that directly contributed to Africa kicking wild polio virus out and improving health outcomes more broadly across Africa. So I worked with eHealth in two contexts. First, as a program officer for the Gates Foundation when I lived in Nigeria between 2015 and 2017. And now as an employee of VSO who has been given a grant from the Gates Foundation and subsequently given a sub-grant to eHealth as we set up and strengthen EOCs across 9 countries in Africa to support the outbreak response for the CVD-PV2 outbreaks that we're seeing. And when I think of eHealth, I think of folks that can get anything done, even things that others believe are impossible to get done in really challenging circumstances. It was kind of such peace of mind to know that when I was traveling across northern Nigeria, I was never far from an EOC, which I just knew would have reliable power, good internet. It was just always a safe space you could go to get things done, which was so amazing, particularly in some of the circumstances up there, which I appreciate were really challenging from an infrastructure perspective, and y'all managed to keep things going kind of day and night, no matter what. The work that you all have done with the EOCs, as well as the GIS work, and on so many other projects was absolutely critical for Africa getting to this milestone of kicking out WPV. So y'all were a huge part of that, and I think y'all should be really proud of your work. I also believe eHealth is really well positioned to continue making its impact on public health across Africa. It's always a pleasure working with you all, so thanks so much for all that you do.
I'm Dr. Kabiru Mohammed. I work with the National Primary Healthcare Development Agency in Abuja. I was posted to Borno in 2017 as the country representative for the Lake Chad Basin Task Team. We have been working with eHealth all along. eHealth has changed the polio program completely. With the inaccessibility along the Lake Chad Basin area, eHealth has given us the support that we needed in assessing and utilizing the technology, mobile technology, to be able to know where the populations are, where the settlements are, whether they are habitable or inhabited or not inhabited. These are the strategies we use in getting at these populations. eHealth also supported in the nomadic vaccination activities, where they help us track the nomadic settlement, nomadic route, and where the nomads are, the seasonal changes, which we uploaded in the Lake Chad Basin Task Team server to be able to map up and assess intervention in these areas. And eHealth also help us in preparation of maps, using geolocations, using VTS, so that the whole program will be impacted positively, and they help us in taking care of reaching almost all the unreached settlement with vaccination and surveillance. And eHealth also extend their hand of friendship to other PSC activities, such as malaria campaigns, such as other non-polio related nutrition. Anywhere you call eHealth, eHealth are there to help. Recently, we are working on the sensitization of nomadic populations, and eHealth are willing to help us with support with their Android phones, geolocate, so that we'll be able to take the geolocations, the ODK, and the VTS. We'll map it so that we know where the settlements are and locate where services are for this population. They are the very vital population that we are left now that could bring in polio virus from our neighboring countries, especially the CVD PVs that are around the Lake Chad countries, especially Chad and Cameroon. Though we have very few in Niger Republic. eHealth have been very wonderful. Even during the time we go for Lake Chad Basin TAC meetings in Jamena, eHealth are very prominently presented, and we continue to appreciate them, and we hope they will help us in broader PSC activities. Thank you very much.
On behalf of the Primary Healthcare Management Board and the CEREC team, I wish to congratulate eHealth for clocking 10 years of excellence in service delivery, both in health and other aspects. We have engaged with eHealth for a very long time, and they have brought tremendous improvement from the way we conducted our activities. In fact, we have become a model for studies where other states come to learn what we have put together with eHealth to improve the health sector of their state, be it immunization, surveillance.
My name is Maina Modu. I'm the current program manager of SERIC. I have been in the field of immunization for over 20 years or more. And my experience with eHealth is started when the BTS was introduced in Borno to track our vaccinators well in the field. And I also work with the eHealth as my capacity as a program manager of Borno State, having a lot of innovations implemented in SERIC, one of which is the development of real microplan, which the eHealth has tremendous support to that, and then we have seen result. And also on area expansion as well, because of the participation of eHealth across all the implementing LGS, and we have recorded track of reach, and also we are working, we are having a very good working relationship with the members of the eHealth. They are also participating in SERIC and also participating and delivering as desk officers of most of our LGS. So I'm happy to celebrate 10 years of eHealth. Thank you.
My name is Farooq Namalam, and I'm Director of Health Planning Research and Statistics, as well as the Program Manager SERIC for Sokoto State. It is really great to speak about eHealth. Being the Director of the Health Planning Research and Statistics, and also the Program Manager SERIC, my responsibilities are coordinator activities of donor agency, and eHealth is one of the very important partners that we have been working together on coordinator activities. Our extreme connection with eHealth is specifically on two major areas. Number one, the laudable support we're getting from eHealth around the vaccine distribution across the state. And then the other one is their capacity building, which is always available for our staff. So you can see the impact around eHealth activity in the state cannot be overemphasized. They have tremendously supported us in building the capacity of our staff and also making sure that the state did not witness or experience any stock out of vaccines. And one later thing we are getting from the impact of health is that the state is preparing for integrating to PHC, MOU, and at the same time, now the state wants to own its own vaccine distribution. And eHealth is working towards supporting our human resource to be able to have for them to have the capacity to do the in-source vaccine delivery or distribution across the state. So it is pertinent for me to, at this medium, congratulate eHealth for 1 year good and hard work. It's really wonderful. They're very wonderful people. We really appreciate working with them. So I really congratulate them for this, big milestone. Then with the future, I will never, stop asking for more from eHealth. So with the future, my wishes are, I wish good luck. I wish eHealth good luck with the future. And also my thought are that eHealth will expand and then to reach out to support PSC in other interventions that they have not reached. Thank you for giving me the opportunity to speak. Thank you.
Colleagues, my name is Mr. Almay Somi. Presently, I'm the field coordinator, Rotary International Polio Plus. To start with, being the pioneer IM of Borno State EOC, I know I started this work with eHealth right from the scratch when Atif then was the one that introduced the former manager of eHealth whom we have worked together with. And of course, the relationship was quite appreciative because of the services they provided to EOC when I was the IM from 2013 to 2015. Of course, there was that cordial relationship. I remember the first map that was even shared for all the 27 LGAs were drawn, and I was opportune also to go to eHealth office in Kano and see the kind of work they are doing and the support they are rendering to Borno State. Of course, all those milestones that we've achieved is actually achieved also in the contribution of eHealth to EOC in Borno State, because all the guides, the maps, and I could remember some of even our health camp health kits were even provided by eHealth. I remember 2014 when we have the IPV, eHealth actually supported the state immensely. Now, I would want to appreciate eHealth and tell them happy 10-year anniversary for the immense contribution they have actually done to Borno State. We are proud to be associated with them as part of the organization now. We will continue also to partner with them. So happy anniversary and congratulations, eHealth.
Okay. My name is Lee D. Gambo. Deputy Program Manager, Service Delivery, Borno State Primary Healthcare Development Agency, and Borno State Emergency Routine Immunization Coordination Center. Actually, the contribution of eHealth to the Borno State government in terms of just both polio and routine immunization is commendable, because I can say since the coming of the eHealth, so we're able to even know the places where we can have a population and there is and the place where there is no population. They support us in this GIS mapping and also tracking of our vaccination activity. Even a vaccinator, when he said that he visited that area and looking at the tracks, you should be able to know that he has fully covered that area or not. So in terms of routine immunization, also we have came out with a lot of monitoring mechanism, more especially in terms of this our real micro plan. We were able to take the geo-coordinate of all of our health facilities and they were tagged. So and also in terms of these RI expansions, we used to use this ODK going to the settlement and immunizing children. So in a situation whereby a team has not visited that area, and we will give them feedback that such thing has not happened and they will correct it in subsequent round. Before we started, and there is a lot of challenges, and as time goes on, and we were able to overcome the challenges. So I wish you a happy 10 years anniversary. Thank you very much.
Thank you very much. All the messages from our partners, our board of directors, and our stakeholders. It is really a pleasure to be able to collaborate and partner with such an immense group of people. I would just like to echo the thanks to the many, many list of partners that we worked with, but just to name a few, the Bill and Melinda Gates Foundation, the federal government of Nigeria, as well as the government of Sierra Leone, who have really supported all of the work that we do, as well as the Federal Ministry of Health and the National Primary Healthcare Development Agency. All the work that we do in Nigeria will not be possible without the support of these organizations. Again, going down to the state level, we work really closely with the state governments and the ministries of health in many northern states. To mention a few: Kano, Borno, Bauchi, Kaduna, Katsina, Sokoto, Yobe, Zamfara, as well as Edo states. And the partnership with those states has been very, very crucial to our success. Other implementing partners that we work with include the US CDC, the Nigeria CDC, UNICEF, Rotary International, WHO, VSO, WFP, and many others that have been with us on this 10-year journey. And really, it's my belief that with your continued support, the next decade will be bigger and better for eHealth Africa, as well as for the Nigerian public health landscape in general. So thank you again to all of our partners, all the government partners, the implementing partners, our donors and stakeholders that we work with in the course of making lives better. And on that note, we will then pivot to looking at what eHA is going to do in the next 10 years. So with all of the successes that we have achieved over the last 10 years, we are now looking forward to see what the priorities are, what milestones we hope to achieve in the next 10 years or in the next couple of years. So we'll take a presentation on forward looking for eHA and what we hope to achieve in the next 10 years.
Good morning. We have looked back at our beginnings and now we want to imagine the future, the next 10 years. Before we start, let's revisit 2012, when much of our work started. Polio was declared a public health emergency of international concern because while the rest of the world had successfully eradicated wild polio, it was still endemic in 3 countries: Afghanistan, Nigeria, and Pakistan. In Nigeria, the case was especially serious because it was the only country where the number of new cases was still rising. And based on the location of the new cases in the country, there was a potential for polio to spread beyond its borders. In response, the polio eradication partners in Nigeria, led by the Nigerian government, set up emergency operation centers, EOCs. The EOCs serve as a command center for polio eradication partners to meet, review data, and take prompt actions, especially during immunization campaigns. Much of the data used during these campaigns was geospatial data. eHealth Africa started mapping 11 northern states in Nigeria in 2012 to ensure that the most at-risk states were better monitored. By 2018, this mapping extended to all of Nigeria, and we collected over 3 million records to support decision-making. In 2020, despite the COVID-19 pandemic, Nigeria and Africa were declared wild polio-free. This is where we are now. Post-polio, Nigeria and Africa still have a number of health priorities to address to build a healthier population. To sustain polio eradication and eradicate other vaccine-preventable diseases, routine immunization should remain a top priority. Maternal and child health. We have the opportunity to end preventable deaths among all women and children to greatly improve their well-being. Malaria is a leading cause of death, illness, and poor growth and development among young children. UNICEF estimates that a child dies of malaria every 30 seconds in Africa. Malnutrition should remain on the forefront because adequate nutrition is important in the first 1,000 days of every child's life. HIV continues to be a major global public health issue, having claimed almost 33 million lives so far. Africa has the highest burden of HIV, and the rates of new infections are still rising for several at-risk populations. Even though as an organization we focus on Africa, we know that our work contributes to global goals. We are focusing on these key targets to achieve SDG goals by 2030. We need to do more work to reduce maternal mortality. With our experience with polio and Ebola, we know that we can apply some lessons learned to end epidemics. Wasting still impacts the lives of far too many young children. Under 5 nutrition must be paid attention to. We have been fortunate to be involved in some cutting-edge research, and new diagnostic tools have been developed from their findings. We know we can increase impact when we scale this. 2020 and beyond is the decade of action. In this decade of action, we will mobilize. We know that there is strength in numbers, so we will build strong networks and partner ruthlessly to reach underserved populations with the health services that they need. We will act urgently and be ambitious. The time is now. We will set ambitious goals and work hard to achieve them. We will hold each other accountable so that we can deliver results. We will innovate from ideas to solutions. We will not be afraid to think outside of the box. We are open to new ways of doing things. We are willing to explore the path less taken so we can provide solutions that strengthen health systems and provide communities with the tools that they need to lead healthier lives. We plan on doing this through some specific ways. When we talk about delivering health in conflict and crisis-affected areas, the use of data remains as important as ever. Effective health interventions in conflict and crisis situations are key in ensuring populations are reached with much-needed healthcare services. Historically, the lack of data for planning and monitoring such interventions has been a major challenge. Actionable data has been hard to come by in conflict-affected areas. In Northeast Nigeria, eHA has been able to successfully support data collection and data management activities geared at improving health delivery for supplementary and routine immunization and other emergency interventions. The successful implementation of the data-driven vaccination tracking system contributed immensely to the achievement of the wild poliovirus-free certification for Nigeria. With a robust network of data collection personnel and contributors, eHA has developed and managed a robust database open for global use. These data sets have been used by the National Primary Healthcare Development Agency, ministries of health at state levels, and the humanitarian community in effectively planning and reaching populations affected by the ongoing crises. eHA will continue to deliver data-driven solutions to enable effective planning, monitoring, and decision-making for improving health service delivery in conflict areas. To expand access to medicines, it is necessary to address the challenges in health supply chains, challenges that have led to stockouts and damaged vaccines over the years. With our experience, we will continue to integrate technology into the health supply chain to increase visibility in the health supply chain, help decision makers identify bottlenecks, ensure accountability, and help prevent wastages. Without being an epidemiologist, we have a part to play in stopping infectious diseases. It's no surprise that we're going to talk about the role of data in this. Our goal is to develop the tools and technologies needed to collect and manage data related to disease patterns that can predict and prevent outbreaks. We are encouraged by our previous experience testing and improving point-of-care devices for diagnosing sickle cell and malaria in low-resource settings, and we want to continue to participate in research that can lead to the development of new diagnostic tools and technologies. eHA has a long history of supporting governments to better prepare for and respond to epidemics, from setting up and maintaining emergency operations centers, EOCs, to providing custom-designed software to track and respond to outbreaks. eHA has been at the forefront of epidemic preparedness in Nigeria and beyond. EOCs are an important part of partner coordination to better prepare for and respond to disease outbreaks. eHA built the polio EOCs in northern Nigeria, and beyond polio, the EOCs also support a wide variety of immunization and outbreak activities. These EOCs continue to be used as the standard for establishing and running EOCs elsewhere on the continent during emergencies, from Ebola to COVID-19. Providing decision makers with high quality and timely data is also a crucial component for responding to disease outbreaks. Actionable data is the key to emergency response. We will continue to partner with organizations to improve the quality of the services that EOCs provide, specifically to eliminate bottlenecks and shorten the time taken to respond during emergencies. Capacity building, e-learning. The quality of health services delivered by health workers is largely dependent on their level of knowledge and skills. Recognizing this, eHA focused on building the capacity of the health workforce by providing access to e-learning and m-learning. These platforms proved especially effective during the COVID-19 pandemic. With coursework from routine health care delivery and safety and preparedness, eHA will continue to invest in frontline health workers across Africa. We have developed data solutions for system strengthening. Over the last 2 decades, there has been a growing recognition of the importance of data in achieving sustainable development. In the health field, reliable access to up-to-date and high-quality data is crucial for effective planning and decision-making. Over the years, we have built an extensive geodatabase that contains over 3 million data records. In order to ensure that this data can be actively used by stakeholders, we continue to build solutions that use the data for improved decision-making, resource management, and health service delivery planning. First, the data portal. In order to ensure easier access to this data, eHealth Africa has developed the data portal. This portal gives access to existing geospatial data in Nigeria and increases the ability of stakeholders to conduct evidence-based decision-making and planning. With the portal, stakeholders have access to nationwide data that can be broken down further to the ward level. The portal also allows users to generate maps that allow the visualization of this data. To date, the data now available in the portal has been used for planning, executing, and monitoring polio campaigns that led to the eradication of the wild polio virus. It has also been used to support MPHCDA to plan and monitor a number of routine immunization campaigns, including measles and yellow fever. LOMIS. In order to solve key supply and commodity availability challenges in the public health sector, we developed a logistics management information system, LOMIS, in 2014. This solution leverages the data available in the data portal and was created to enable health workers to track, plan, and move health commodity stock among various locations. The system provides real-time visibility into operations and movement of products across the distribution chain, enhancing accountability across all levels to reduce stockouts and prevent losses. It also provides improved access to quality health commodity and consumption data for target stakeholder resources and distribution planning. LOMIS has been used to track the delivery of over 42 million vaccines and reduce stockout rates to less than 1% at health facilities where used. Planfeld. Location intelligence is vital for planning, tracking, and evaluating the success of field campaigns. When layered with decision support systems, resource planning becomes more effective. eHA developed Planfield, an easy-to-use and highly intuitive tool that removes all the technical details and makes it easy for users to generate robust plans, monitor field implementations, and make improved decisions based on the analysis provided in near real time. Now, when health planners need to decide how many resources they need for the next campaign or monitor the activities of their field staff, Planfield will support their decision-making. We're excited by the challenges and the possibilities that the next 10 years will bring. We want to partner with organizations that will work hand in hand with us and dare us to accomplish even more. Thank you so
Hi, I'm Evelyn Castle.
And I'm Adam Thompson.
Together, we're the founders and executive directors of eHealth Africa.
eHealth Africa was created with a simple idea, that people in Africa could have better healthcare if those providing health services were able to make data-driven decisions with accurate information.
Our belief that careful analysis of data could improve public health was formed while performing research at the University of California, Santa Cruz.
Once we started working in northern Nigeria, we implemented our solution by leveraging technology to allow for better decision-making.
We wanted to develop sharp and original ways to streamline health service delivery and emergency response through the integration of information, technology, and logistics.
After moving to Nigeria in 2010, we learned that clinics were overwhelmed by paper records, and there was little ability among staff to accurately track and report patient information.
We helped a family health center in Kaduna State, Nigeria, to move from paper to an electronic medical record system, or an EMR. Within the first year, staff were able to input 1,000 children's vaccination records, track and report their progress via the EMR.
The monthly data reports also allowed for better financial oversight, and even revealed that vaccine funds were being misappropriated.
In 2012, Nigeria was the only remaining polio-endemic African country, and the number of new wild poliovirus cases were increasing. As part of the nation's response to this emergency, the Emergency Operations Centers, EOCs, were introduced as command centers for polio eradication partners to execute a coordinated response to polio. We first joined polio eradication efforts in Nigeria by building Nigeria's EOCs.
I'm working with eHealth Africa for 8 years. We started off with 8 polio emergency operations centers and then diversified into other projects like the Kano Connect, Endgame Strategy, and come 2020, we have been certified polio-free. I've learned a lot of things working with eHealth for this past 8 years. Every day is an adventure. Every day is a learning process. So if you work for eHealth Africa, you just don't work for working's sake. You are being developed mentally, emotionally, and technically. So to eHealth Africa, I say a big thank you for having me for all this while, and I look forward to many more conquerors like we conquered the polio.
We continued to support Nigeria's polio eradication efforts by mapping 11 northern states to support the microplanning of vaccination campaigns. As our work increased, we also expanded our footprint in the world to support our ability to deliver. The Berlin office opened and our global health informatics team grew. As we became more involved in Nigeria's polio eradication program, we observed several gaps in immunization service delivery. In addition to providing technology-based solutions, we also began to provide solutions to challenges in logistics and supply chain management. In late 2013, an Ebola virus disease outbreak started in Guinea. This outbreak was not detected until March 2014, when both Guinea and Liberia reported cases of the disease. By May 2014, Sierra Leone also reported its first case. On July 24, 2014, Nigeria reported its index case of the Ebola virus disease, setting off a chain of transmission that would include 19 other people and result in 7 deaths. Based on our experience in setting up the polio EOCs, eHealth Africa was invited to help the country respond to this new public health emergency.
During the Ebola outbreak, we were one of the first responders to respond with the federal government. We were able to deploy to Lagos within a couple of hours. In 24 hours, we were able to deploy our core team to Lagos to do an assessment of the situation and the location that was being proposed for an emergency operation center at that time. After that, we took a very challenging task, which was to set up a fully operational center for the emergency management in less than 10 days. We worked very, very long hours, sometimes 18, 19, 20 hours a day to achieve that. At the end of that period, we were able to provide the state and the Federal Ministry of Health with a state-of-the-art emergency operations center, which was key in tackling the Ebola outbreak.
After eHA's success in helping the government of Nigeria contain the Ebola virus disease outbreak, we were invited by several partners to bring this experience to fight the outbreak in other West African countries.
eHealth Africa supported the polio eradication initiative in Nigeria by setting up emergency operations centers in 2014. Being an emergency management support organization that we are, eHealth Africa also played a significant role in the control of Ebola in Nigeria in 2014. By late 2014, eHealth Africa joined many other public health stakeholders to provide emergency management support to the Ebola outbreak in Guinea, Sierra Leone, and Liberia. With funding from CDC Foundation and Paul G. Allen, in 2015, these countries were declared Ebola-free. With a focus on health system strengthening, eHA continued to provide support through an award of a CDC cooperative agreement in Liberia and Sierra Leone for the next 3 years. With significant progress achieved in the region, our project closed, and so did our country office in Liberia and a scale down of our Sierra Leone office.
After we supported the health systems in West Africa to end the Ebola virus outbreak, we focused on health system strengthening in Sierra Leone and Liberia to ensure that each country could start the journey to recovery and be better prepared for future public health emergencies. In Nigeria, we continue to work with polio eradication partners to introduce new strategies to increase the uptake of the polio vaccine.
Health camps is a project that I find very dear to my heart because it's the very first project that I started with at eHealth Africa. The Health Camp project is a project that was launched in 2014 in partnership with the state government in Kano, as well as some key stakeholders. Basically to provide and distribute, set up health camps, which eHA's major role is to distribute health camp boxes across the 44 LGAs of Kano. These health camp boxes contained essential medicines and drugs that were used to treat very common diseases that are found within the community. In 2015, eHealth Africa recorded a significant increase in the number of health camp boxes distributed across the 44 LGAs in Kano State. Also, in the same 2015, an exciting aspect of the business happened at eHA, and this is the movement from the old office, which is eHA's first office actually, to the permanent headquarter office located on Independence Road, where we currently are now.
Throughout 2015 and 2016, we continued to support health system strengthening in West Africa. We built our public health emergency and disease surveillance projects portfolio, helping countries increase their capacities to prepare for, detect, and respond to public health emergencies. In 2016, the polio eradication efforts in Nigeria suffered a setback when 2 new cases were reported in security-challenged Borno State. A public health emergency was declared in the Lake Chad Basin. Following the success of health camps in Kano State, the project was introduced in 7 local government areas of Borno State.
eHA's intervention in Borno State has been an exciting one. We got into Borno State in 2016 after the 4 cases of WFPV were discovered just at the point when Nigeria was expecting to be certified WPV-free. It was important to ascertain why those locations were possibly not visited, and also provide a means to verify that vaccination team members have reached every location they were supposed to reach. So eHA's intervention in Borno State has largely been around data management support and technical support even at the field level to help the state both plan, monitor and provide accountable feedback for activities carried out by vaccination team members. The major activities we provided around technology support and data management were deployment of vaccination tracking systems, which is a passive tracking application on Android devices carried by vaccination team members. And this helps us to identify locations where they have also reached. Now, this also helped us make sure that there is a comprehensive master list of settlements that would help us effectively plan. So we also carried out data collection activities. In order to ensure that there is verifiable records and accountability for the coverage of vaccination team members, this geospatial information is provided back to the state. They use this for planning, they use this for monitoring, and they use this for providing feedback to the LGA teams, to the state teams, and to the national in order to be sure that we are effectively planning and reaching children under 5 with polio vaccines. A few other milestones that we've achieved is about the support we provided for AFP surveillance and being able to map locations where AFP cases were reported and investigated, and that helped also plan and effectively track these cases while trying to achieve wild polio certification for Nigeria. It's proud to actually mention that the intervention in Borno State, especially the geospatial technology and data management support provided by eHA, have contributed effectively and enormously to the achievement of WPV certification in Nigeria.
eHA's strength is designing and deploying technology-driven solutions that are suited to the context in which we work. We are able to do this because our team consists of people who live in the communities we work in. We know that the secret to sustaining the gains we have recorded is to build local capacity to continue the work we have started.
I am currently the head of the engineering department at eHealth Africa. I joined eHA in 2015 as a consultant, and then changed role to software development, and then I'm finally here in the Nigerian office. So while in Guinea, one of the major projects that we had was the eHA Academy. So the eHA Academy is the 8 weeks program to build capacity in software development, GIS, software project management, as well as networking and database management. So for the first session of the academy in Guinea, we had about 30 participants. And out of those 30 participants, we selected 3 of the best candidates to join eHA as full-time software developers. And they went on to work in Guinea, Liberia, Sierra Leone, as well as Nigeria here. Because of the success of the first session in Guinea, we decided to replicate the same thing also in northern Nigeria, starting with Kano. So again, the objective is to really build capacity in software development and just enable the young population here to be able to either find jobs with eHA or just be able to build their own startup or join other organizations as software developers, either as data analysts or UI/UX designers.
In 2018, we continued to gather, collate, and analyze the data that enhanced planning and decision-making in health systems across West Africa. With first-hand knowledge of how data and technology were strengthening public health emergency management, health delivery, and disease surveillance systems in Africa, we began to explore other focus areas such as the nutrition and food security systems and laboratory and diagnostic systems. We expanded our portfolio with more projects in those focus areas and also delved into other priority diseases, including malaria, pneumonia, and meningitis, so that we could contribute more to addressing ongoing public health issues in the region. Our team did some award-winning work, and eHA was recognized for our work in building innovative solutions and delivering impactful projects. As a way to live our values, we created several events and platforms where we and our partner organizations could share our knowledge and expertise to build our communities and encourage local talent. In 2020, the world faced a new public health emergency with the COVID-19 pandemic. However, Nigeria was better prepared to respond to this new threat. The Nigeria Center for Disease Control and Prevention is successfully leading the response to the pandemic, and the existing EOC infrastructure is being used by states to continue to respond to the ongoing emergency. While the world dealt with the pandemic, Nigeria was declared polio-free. This was made possible by all the partners who worked collaboratively across state and national levels to reach every child. With the certification of Nigeria as polio-free, the entire African region was certified wild polio virus-free on August 25, 2020.
The last 10 years at eHealth Africa has been an amazing journey. Over the last 10 years, we have provided the government and our key partners with access to real-time, geo-enabled data that has improved decision-making. One of the things that we're really proud of is being part of the team that has enabled the country to achieve polio-free certification in 2020. Looking forward into the future, we hope to continue to leverage the expertise and the innovations that we have gained in the polio eradication fight into other public health outcomes. We hope to continue to use the data and the infrastructure that we have established in fighting other critical diseases. And at the end of the day, we want to ensure that the underserved communities that we reach have better lives.
Our first 10 years have been full of rewarding experiences and great milestones. We are looking forward to another 10 years of strong partnerships, great experiences, and even bigger successes.
Good afternoon, everyone. Happy anniversary, 10th anniversary for eHealth Africa. My name is Zahir Baloum. I'm Chief Financial Officer and Senior Director of Administration at eHealth Africa. It's our hope that based on the experiences we have had over the last decades, we will continue to work with our partners and all of our hardworking staff on this journey to achieve greater milestones and bigger successes. On behalf of the entire eHealth Africa team, I want to thank you all very much for celebrating with us today. Looking forward for another 10 more years of productivity and impacting so many people in Africa, and especially in Nigeria. Thank you.